Welcome to Spectrum Parents Academy. Today we're diving deep into a topic that every parent of an autistic child has faced: understanding behavior. What if I told you that your child's behaviors, no matter how challenging or unexpected they may seem, actually have a reason behind them? What if, instead of stopping the behavior, we first asked, what is my child trying to communicate? Let's explore how stress, sensory overload, co-regulation, and even medical factors like vitamin deficiencies can shape behaviors, and most importantly, what we can do to support our children. Let's start by rethinking how we see behavior. Many of us were taught to see behaviors as good or bad. But what if, instead of seeing a meltdown as bad, we understood it as a signal, like a fire alarm alerting us to something deeper? Autistic children often communicate through behavior. If they're unable to express what they feel or need with words, they will show it with actions. So before reacting, let's pause and ask ourselves, what is this behavior communicating? What environmental, sensory, or emotional triggers might be contributing? Our children's behaviors are not random, they are messages. And when we learn to decode these messages, we can meet our child's needs more effectively. Research shows that autistic individuals often experience higher and prolonged levels of stress hormones compared to neurotypical individuals. This is because their stress response system works differently. What does this mean in everyday life? It means that many autistic children have higher baseline stress levels, making small challenges feel overwhelming. Their stress hormones take longer to return to normal levels, making it hard to recover from difficult moments. Social interactions, sensory input, and unpredictability can all cause stress spikes that result in behaviors like running away, shutting down, or repetitive movements. But here's the most important part. These reactions are not intentional misbehavior. They are the nervous system's way of responding to stress. Instead of controlling the behavior, we need to focus on reducing the stressors that trigger it. Now, stress is not always the only factor behind behaviors. Medical and nutritional imbalances can also play a big role. Parents often don't realize that deficiencies in vitamins and neurotransmitters can make self-regulation even harder. Let's go through a few examples. Neurotransmitter deficiencies. Low serotonin can increase anxiety, aggression, and depression. Low dopamine can make it hard to focus, stay motivated, or control impulses. High glutamate can heighten sensory sensitivities and stress responses. Vitamin and nutrient deficiencies. Magnesium deficiency can lead to increased repetitive movements, hyperactivity, and trouble sleeping. Vitamin B6 deficiency can cause irritability, aggression, and emotional instability. Iron deficiency can result in fatigue, low concentration, and even pica, eating non-food items. Omega-3 deficiency can affect emotional regulation and increase impulsivity. Zinc deficiency can lead to picky eating, appetite issues, and frequent emotional outbursts. If your child's behaviors have intensified suddenly, or if they seem harder to regulate than usual, consider speaking to a doctor about nutritional testing. Sometimes, something as simple as correcting an iron or magnesium deficiency can make a noticeable difference. Now that we understand the stress and biological factors behind behavior, let's talk about one of the most powerful tools we have: co-regulation. Co-regulation means that before a child can calm down, they need to feel the calmness of a regulated adult. Think of yourself as their anchor. If you stay steady, they have something secure to hold on to. If you react with stress, they feel even more unsafe. Signs that you are dysregulated. You feel overwhelmed or impatient. Your voice gets louder, or you want to shut the behavior down immediately. Your breathing becomes shallow, and your body feels tense. Action steps for self-regulation. Pause, take a deep breath before reacting. Check in, ask yourself, what am I feeling right now? Ground yourself. Feel your feet on the floor. Take slow breaths. Slow down, lower your voice, and move more gently. Reframe the situation. Instead of thinking, why is my child doing this? Try, what does my child need? The more regulated you are, the better you can help your child feel safe and connected. Let's go through some common behaviors and what they might be communicating. Repetitive movements. Stimming. Possible meanings: self-soothing, excitement, or sensory regulation. Medical consideration: magnesium deficiency or high glutamate levels. Support: allow stimming unless harmful, provide alternative sensory input. Running away, bolting. Medical consideration: iron deficiency can contribute to impulsivity. Identify triggers, provide safe movement breaks. Aggression or hitting. Possible meanings: communication frustration, deep pressure seeking. Medical consideration: low serotonin or vitamin B6 deficiency. Stay calm, redirect to a sensory alternative. When we start seeing behaviors as messages instead of problems, we move toward compassionate and effective support strategies. So, here's your challenge for this week. Observe your child's behavior through the lens of communication. If a behavior is challenging, ask what might be triggering it. Is it stress, sensory, a medical issue? Share your thoughts in our private community. What behaviors have you decoded? What strategies have helped? We are in this together, and every small win matters. Until next time, remember, your child is not giving you a hard time. They are having a hard time. Let's learn how to support them together.